I'm now going to do the pons and the midbrain, and we just finished the medulla. So I first want to explain how I'm going to take the sections in the pons and the midbrain. Up here in this diagram, which is a sagittal section of the brain, what you're looking at is this is the midbrain. This part here is the pons. And if you remember, this was a diagram that I had drawn when we were doing the medulla, and this is the medulla. This is the ventral aspect, and this is the dorsal aspect of the brain. So here you can see this is the cerebellum lying on the dorsal aspect. So here, when in relation to the midbrain, notice on the dorsal aspect, these are the colliculi. This cavity here, this cavity is the aqueduct. So you can see this is the aqueduct. This here is the fourth ventricle, and notice in the fourth ventricle the roof is formed by the cerebellum. So you can see the cerebellum is forming the roof, and in relation to the pons, can you notice that most of the nervous tissue of the pons lies anterior to the fourth ventricle? Posterior to the fourth ventricle, you only have this thin film of nervous tissue. So therefore, when we take sections of the pons, you will notice that you'll only get thin, you'll just get posteriorly, you'll see the fourth ventricle and just a thin area above. When we were doing the medulla, if you remember, we took sections of the medulla. The first two sections showed this central canal. So you can see this central canal. We took two sections up here. And then the third section went through the upper half of the medulla, where you can see that this fourth ventricle was opened out. So that's how we are going to be taking these sections. Now what you must also remember is, as given in your description, make sure you go and look at the first few slides of this PowerPoint. So I'm going to go back to them. So here, when you see the PowerPoint, notice that the pons, and we saw that from the previous slide that I just showed you, the pons is anterior to the cerebellum. It connects the midbrain with the medulla. And you can see that this anterior or ventral surface, the ventral is the same as anterior. This anterior surface is a convex surface with a little sulcus in the middle. And these are the transverse ridges which are seen on the anterior surface, and they converge to form the middle cerebellar peduncle. So every time you read any information, always have the PowerPoint slide in front of you so that you can confirm what is being said in the description in your notes with what is shown on the image. Then we also see that the trigeminal nerve emerges on its anterolateral aspect. This trigeminal nerve has a large sensory component and a smaller motor component. So I don't know if you can see, the motor component is the smaller part and the sensory is this larger part. Then at the pontomedullary junction, you have the sixth cranial nerve, which is not shown here, and then you have the seventh and the eighth present more laterally. The posterior aspect, which is this, is actually hidden by the cerebellum. So the cerebellum really lies on top of it. So once you remove the cerebellum, then you see this posterior surface, and you can see that this posterior surface forms the upper half of the floor of the fourth ventricle. Laterally, this posterior surface is limited by this superior cerebellar peduncle. And then notice how it's divided into two parts by a median sulcus, and on either side you have this swelling which is present, which is known as the facial colliculus. So this is how you're going to look at it. Now let's look at the sections of the pons, and we take the sections at two levels. The first level is at the level of the facial colliculus. So let's go here. So somewhere here at this point is where the facial nerve is, and it's going to raise a little bump here. That's the facial colliculus. So we'll take one section here at the level of the facial colliculus, and the next part is somewhere here where we'll take it where the fifth cranial nerve is emerging. So that's where we are going to take the sections of the pons. So let's look at the lower level of the pons, which is at the level of the facial colliculus. So here again, make sure that you understand what nuclei are going to be seen, what tracts are going to be seen, motor and sensory. Now at the level of the facial colliculus, which is the lower level, and again just to go back to this slide up here, what we are going to do is that we are going to take this section at this part of the pons. We're taking it at this, somewhere at this level of the pons. You know, we are going across like this. So you can see that posteriorly we see the facial colliculus, and that is the point where this facial nerve emerges up here, the 7th and the 8th. So we'll see the nuclei of the 7th and the 8th, and we'll also see the nucleus of the 6th. So these will be the motor tracts, which are the cranial nerve nuclei, which we'll see some motor tracts and sensory tracts. Now whenever we talk of the nerves which are present, then you also have to know the function of those nerves. So therefore we also see several nuclei related to those nerves. Now therefore it's very important when you're looking at these nuclei that you go back and look at the at that list that is at the beginning of your notes regarding the function of those nerves. So as I said, if we take a section here, we are going to see the 6th, 7th and 8th cranial nerve nuclei. Now the 6th, it supplies muscles of the eye, and it supplies one muscle of the eye, which is the lateral rectus. So we are only going to see a motor nucleus of the 6th cranial nerve. The 7th has a lot of functions. It supplies muscles of facial expression, so the muscles of facial expression. So we'll see the motor nucleus of the 7th. Then the 7th also carries taste fibers. So you'll see a little bit of that tractus solitarius up here. You may or may not see. If it's not shown, it's just that, you know, the section's been taken higher up. But if you see it in some books, just remember that's because it's responsible for carrying taste. Then the 7th participates in both its parasympathetic, this is the parasympathetic component, which participates in lacrimation and in salivation. And what does the parasympathetic supply? It supplies glands and smooth muscle. So in the head and neck, all those glands which are supplied are through parasympathetic, the parasympathetic part, which travels with the various cranial nerves. We already did, if you remember, we did the 9th in the medulla, and that was for the parotid, which again you can see is a gland. So that's why we have the inferior salivatory nucleus. Now the 7th is concerned with lacrimation and salivation. So hence we will see the lacrimatory nucleus here, and we'll see something called the superior salivatory nucleus, because this is for supply of your sublingual and submandibular glands. So that's why that's what you're going to see at this point. So if you look at your nuclei, you have the abducent, which is the 6th cranial nerve. You'll have the facial nucleus, and then you'll have the parasympathetic component, which is the salivatory and the lacrimatory. I told you taste may or may not be present, but you must remember that 7th also carries taste. So some of the fibers probably descend, they go down and they go into the nucleus of the tractus solitarius. Now at this point you also see the spinal nucleus of the trigeminal, and you also see what are known as pontine nuclei and the trapezoid nucleus. Now the pontine nuclei I'll explain when we look at the section. The spinal nucleus of the trigeminal, I told you all when we were doing the medulla of how this trigeminal nerve has nuclei which go all the way from midbrain down up to the medulla. So you know that's up here you're looking at the spinal nucleus. That same spinal which you saw in the medulla, you're looking at that up here. The trapezoid nucleus, again I'll explain when we do the auditory pathway. The tracts, you're still going to look at the corticospinal, the corticonuclear tracts. Now here you have an addition of another tract, which is the corticopontine tract, and I'll explain what these are. These are corticopontine tract, and then you will see what are known as transverse pontine fibers. So these two are things which I'm going to explain here. Under the sensory tracts, you only see the anterior spinocerebellar, because remember, the posterior spinocerebellar left and went off through the inferior cerebellar peduncle. Then you'll have the spinal tract of the trigeminal, which we saw in the that in the medulla. So now that's going to continue upwards. We will see the spinal and the medial lemniscus. They have to go all the way up, so they are just continuing from the medulla. And now in the pons, you have the addition of the lateral lemniscus. So the lateral lemniscus begins to get added now here in the pons, because this is where we have the auditory pathway. So this lateral lemniscus is part of the auditory pathway, and we see now that this is what is added in the pons. So this is just a brief discussion of what you're seeing, and now let me go on to the actual section and let's look at that. So let's come back and look at the actual section of the pons, and here we go. So here we are looking at the pons. So this section has been taken through the lower part of the pons, and if you remember, I told you most of the nervous tissue lies in front of the fourth ventricle. So this is the cavity of the fourth ventricle, and that little bit of nervous tissue which is present behind is called the superior medullary velum. You don't need to remember this name, but just in case you're wondering what it is, it's that little bit of nervous tissue which lies behind the fourth ventricle, which I explained when I showed you the sagittal section. Now most of this nervous tissue is lying, as you can see, in front of the fourth ventricle, and this is further divided into a posterior part. So this part here, this posterior aspect, so let me just show you this posterior aspect. This region is known as the tegmentum, and then this anterior of the two. When I say posterior aspect, it is not posterior to the fourth ventricle, but the posterior of these two parts. So this one is known as the tegmentum, and this anterior aspect is known as the basilar part. And this division is based on fibers which cross this way, and these are known as the transverse fibers of the trapezoid body up here. And again, I'll explain that when we do the auditory pathway. Now let's look at this section and confirm everything that we discussed so far. So I'm going to remove that, and let's start from here. So again, the gray matter now is again broken up into little islands, and you don't see a typical gray matter, and we saw how in the medulla, you had these little bits of gray matter. So let's look at the first thing that we see here. So again, if you want to kind of remember the gray matter, this is how, the spinal cord, the gray matter of the spinal cord was this way, and with the central canal. Now the central canal has gone to the back up here, so all this gray matter has just been broken up. So instead of being a continuous thing, you just see little bits of gray matter. Some of them will correspond to the anterior horn cells if they are motor, and some of them will correspond to the posterior horn cells if they are sensory in function. So let me begin now with the first bit of gray matter that you're going to look at. And again, you should be able to tell these nerves based on their relationship with the pons. So if you remember the pontomedullary junction, so let me draw it here. So that's the pons, and this part here was the medulla. That's the pyramid, that's the olive and inferior cerebellar peduncle. Sorry, pyramid, the olive and inferior cerebellar peduncle. Remember, the sixth came off medially, the seventh and the eighth laterally, with the eighth being most lateral. Okay, so this is something you must understand. So now let's look here. So this is the midline. This is that little sulcus up here, which is the groove for the basilar artery. So posteriorly, the first sort of group of gray matter which forms a nucleus closest to the midline we see is the sixth nerve nucleus, which is the nucleus of the abducens nerve. So notice this is the sixth nerve nucleus, and then it's from this the fibers come out forming the sixth nerve. So you can see the fibers are coming out closest to the midline. So this is the sixth nerve which comes out, the abducens nerve. Then what happens is, lateral to it but not close to it, we have the seventh nerve. So you can see the seventh nerve nucleus. What really happens is that this seventh nerve originally, so if this was the sixth nerve nucleus, the seventh nerve originally was lying here, but then this seventh nerve actually moved and these fibers went out this way. So what happens, its position shifts. So this seventh nerve actually moves in this fashion and comes to lie here laterally. So when it does that, can you see now its nucleus, this was the nucleus, it's going to pull the nerve with it, and now the nucleus comes and lies here. So this is the seventh nerve nucleus. As it does that, so this is the nucleus, and then the fibers wind around this sixth nerve and then come out, and then you can see they're coming out lateral to the sixth. So this is the sixth, and here is the seventh nerve. So as they do that, these fibers kind of raise a bulge over the sixth nerve, and that bulge is known as the facial colliculus. So this facial colliculus is formed by the nucleus of the sixth and the fibers of the seventh winding around the sixth. So here is the bulge that they form on the floor of the fourth ventricle, and that is known as the facial colliculus. So that's the seventh nerve. Now which part of the seventh nerve is this? This is the motor part. So this is the motor nucleus, as was this, and this is equivalent to the anterior horn cells. So these give rise to fibers which go and supply muscles. So the sixth goes to supply the lateral rectus of the eye. This seventh, the axons, go to supply the muscles of facial expression. But we also said that the seventh had other functions, which were to supply the muscles of, to supply the glands, and that was the parasympathetic component which traveled with the seventh. So that is this red part is the lacrimatory and the salivatory nuclei. So I've just put them both together. So fibers from here, from the lacrimatory and salivatory, belong to the parasympathetic nervous system, but the axons travel out, they go with the seventh. So you can see they are traveling with the seventh nerve nucleus. So these are the parasympathetic preganglionic fibers. They'll travel with the seventh. So the parasympathetic preganglionic travel with the seventh, so they go out, then they will synapse in a ganglion, and then the postganglionic fibers will start from here and they'll go to the lacrimal gland or to the salivary glands, which are the sublingual or the submandibular. So that's how you can see. So if you were asked what kind of fibers travel or emerge from this salivatory or lacrimatory nuclei, you would say the preganglionic parasympathetic fibers, and they're using the seventh nerve. They're going with the seventh nerve. So that's how they go out. The seventh has also got a taste component, which I said is not, you don't see it over here, because what will happen is some of those fibers which are for taste, they are really part of the sensory pathway. So let me show you here in this. If you remember, this was showing you the taste part of the seventh. So if this, let me say that this was the seventh nerve like this. This is the whole seventh nerve. The seventh has both motor and sensory components. The motor was the one that the nucleus that you just saw, the nucleus in the pons. So let's say that that was the nucleus. The fibers came out and then they traveled in the seventh nerve and went this way to go into the muscles of facial expression. The other part was the salivatory and lacrimatory, so they also go out in the seventh, go this way. These are preganglionic and they get out this way. Taste travels in the seventh in the opposite direction. So seventh is a mixed nerve. So the taste fibers go in here. they have their cell bodies, as you can see, in the geniculate ganglion. So in the seventh nerve, there'll be a ganglion at this level, which is called the geniculate ganglion. They will travel in with the seventh, but instead of going up all the way like this, what they'll do is the fibers come down, synapse in the tractus solitarius, and then form the taste pathway. So can you understand that the seventh is therefore a mixed cranial nerve, which has fibers going in both directions. Now we don't show the seventh here in the pons only because this tractus solitarius, this nucleus of the tractus solitarius, remains pretty much in the medulla. But just if I was to just take a little bit of a liberty and I just moved it up into the pons, you can see that these fibers, because the seventh is at the pontomedullary junction, you can see that some of these fibers are synapsing at the upper limit of this tractus solitarius nucleus. So that is the nucleus that you're seeing that you're not seeing here, but understand that the seventh also has a taste component, which is why we saw it lower down. Now the other nuclei that you're seeing, and I'm going in order, you see the vestibular and the vestibular nucleus here. The cochlear was seen more at the level of the medulla. So you're seeing the vestibular nuclei because the eighth cranial nerve, remember, it was the lateral most nerve. So this is the vestibular nucleus that you're seeing at this point. And then you're seeing the spinal nucleus of the fifth. So here is the spinal tract and the spinal nucleus of the fifth. So these are coming up. They are, the remaining. You saw them in the medulla. You continue to see them in the pons. The nucleus is the dark one, and the light one. The nucleus is the dark one, and the light one is the spinal tract, continuing from the medulla. Then we see what are called pontine nuclei. And again, just to refresh your memory, if you remember when we were doing these tracts, I showed you these descending tracts. When we looked at the tracts, if you remember that in the midbrain, these tracts were, complete. This corticospinal corticonuclear was a whole tract. But when it came to the pons, these tracts got broken up into smaller parts because of the presence of little nuclei, which are called pontine nuclei. So these were pontine nuclei. So that's what we are seeing now at the level of the pons. So when we take a section, you can see that this is where those pontine nuclei are present. So the pontine nuclei are seen at this level. So now I'm going to show you the same section and show you these pontine nuclei present here. So here's where these pontine nuclei are present. So that's what they are. They are little nuclei present in the pons. They are islands of gray matter. And what happens is that the fibers from different parts of the brain, fibers which do not contribute to these corticospinal tract. So there are fibers coming from the frontal lobe, there are fibers coming from the parietal, fibers coming from the occipital, and fibers coming from the temporal. These are fibers which keep in touch with the brainstem. So they are not giving rise to the corticospinal. They just come down. So these are just known as corticopontine fibers. So they're coming down. And what they do is these fibers, as they come down, they come and synapse on these pontine nuclei. Having synapsed in the pontine nuclei, now the second set of fibers cross over to the other side. So we call these fibers corticopontine fibers. And then from here, these fibers go from the pons, they go via the middle cerebellar peduncle, they go to the cerebellum. So these will be called pontocerebellar fibers. So you can see these are called pontocerebellar fibers, and these are what are responsible for the transverse pontine fibers, because you can see they're going transversely across. We all know that the brainstem is in constant communication with the cerebellum by means of those cerebellar peduncles. We saw how in the medulla, through the inferior cerebellar peduncle, the vestibular and the cochlear nuclei send fibers across. We saw how the posterior spinocerebellar fibers moved across. Now here in the pons, it is this corticopontine which have synapse, and then now we have pontocerebellum. By this, the cerebellum gets information about what's happening in the cerebral cortex, because it's sending the information to the pons, and then the pons relays it to the cerebellum. So notice how the cortex and the cerebellum are in touch with each other through this. So that's what these fibers are. So that's what the pontine nuclei are meant for. Now, those are, I think I've covered most of the nuclei that that you have in your notes. Now let us look at the tracts. The motor tracts, we'll see those corticospinal and corticonuclear fibers. Those will be present here, distributed in between these pontine nuclei, and they are kind of as broken up into bundles. So, you know, in between the pontine nuclei, you have those bundles, as I showed you earlier. Then I've already mentioned we have these corticopontine fibers, which you have not seen. So in between these bundles, you'll have fibers which are those corticopontine fibers, and then we have these transverse pontine fibers. So these are what are present in this basilar part of the pons. The sensory tracts will be the tracts which are coming from below. Now, in the cerebellar, we don't have the posterior spinocerebellar because that went off through the inferior cerebellar peduncle, but we'll still have the anterior spinocerebellar. And let me see if I find it over here. I'm looking for the anterior spinocerebellar, but I don't see it being shown up here, but I'm going to show the anterior spinocerebellar. So let's just put the anterior spinocerebellar up here. So I'll label this. This is the anterior spinocerebellar. You still see it here. It goes out through the superior cerebellar peduncle, and we'll see how it goes out in the midbrain. Then what you see here, the spinal tract of the trigeminal, again, that remains, the spinal tract of the trigeminal. We will see the spinal and the medial lemniscus. The medial lemniscus is more medially placed, and the spinal lemniscus is a little lateral to it, which is this one. So, you know, this is where the medial lemniscus will be. This is the spinal lemniscus. And then we have the addition of this lateral lemniscus. That lateral lemniscus begins to get formed over here, and this is the auditory pathway. So this is the auditory pathway, and that gets formed here. So you can see the lemnisci are kind of lined up together. So we have the medial lemniscus, then we have the spinal lemniscus, and then we have the lateral lemniscus. That's why they're named. This is lateral, this is medial. The medial lemniscus and the spinal lemniscus will be joined by fibers which come from that spinal tract, and we'll see the trigeminal nuclei. They kind of join them so that the entire body gets represented here between this for touch, pain, and temperature, and that discriminative touch and you know, stereognosis and all of that. And this, of course, is the auditory pathway. So these are all the fibers that you're seeing at this level of the lower pons. So this is all that you're seeing at the level of the lower pons. In case you're wondering what these blue fibers are up here, these were I was just trying to show the corticopontine fibers from the cortex, which I just drew. So these blue fibers, it just shows you that they're synapsing here, and then the pontocerebellar start off. Let's look now at the upper level of the pons, which is here. So now in the upper level of the pons, so we've taken a section a little higher up, and this is the point where, so the section has been taken a little higher up at this level. So we are taking it here at this level a little above, so you don't see the facial colliculus, but now you're looking at the trigeminal nerve nuclei. So that's where we are taking this. So let's go to look at the section at the upper level of the pons. The arrangement remains the same. This part is the tegmentum, this part is the basilar part. Now we'll see in this, let us look at the nerve nuclei that we'll see. We see the fifth cranial nerve nuclei. Now the fifth, if you remember, what does the fifth supply? It has a big sensory component, so very big sensory component, and a small motor component, because this is for muscles of mastication and a few of the other muscles like the anterior belly of digastric, mylohyoid, and so on, and you should know those. So we'll see these two, a big sensory nucleus and a motor nucleus. Now at this level of the pons, remember the lower level of the pons, the sensory part we call the spinal nucleus. Here we call it the sensory nucleus of the trigeminal, and it's known as the main sensory nucleus of the trigeminal. Then we have the motor nucleus of the trigeminal, and you can see in this case the motor nucleus will send its axons this way going to those muscles. The sensory nucleus has its cell body up here in the trigeminal ganglion. So that's why you can see this being drawn here, and the impulses pass this way. So these are the two nuclei. Then we see those pontine nuclei. So, you know, those pontine nuclei are present here. So those continue. And then we see a nucleus present up here in this region, which is called the trapezoid body. We actually have a nucleus present here, and that's known as the nucleus of the trapezoid body, or the trapezoid nucleus. The tracts, at this point, the motor tracts remain the same as the lower level of the pons. So you will see the corticospinal and corticonuclear fibers. You will see the corticopontine fibers. So those come down, and then you see those transverse pontine fibers. So you see those motor fibers. At this level, the lemnisci, which you will see, or the sensory tracts, you see the lateral, you see the spinal, and then you'll see the medial lemniscus. At this level, why the anterior spinocerebellar is not being shown is because the superior cerebellar peduncle is so close that the anterior spinocerebellar passes out at this point. So it's passing out at this level. Actually, these fibers cross over and then they go. So that's why we don't show it. So that's why you're not seeing the spinocerebellar tract. So this is what is seen at the level of the pons. So whenever you're studying this part, it's very important to be able to recognize the picture to see what the pons looks like. It's very, very important to see what nuclei are present. So you must know these sections. You must get a very good visual in your brain. This picture should be kind of imprinted so that you know exactly what you're going to be seeing at that point. So look over these pictures over and over again. Let's now move to the midbrain. So we are going to go to the midbrain, and in the midbrain, again, just so that you remember, I told you in the midbrain we took two sections. We took a section which went from the lower part of the midbrain, and that section cut across the inferior colliculus, and then we will take another section which goes across the superior colliculus. So these inferior and superior colliculi, which are these, are present posteriorly, and anteriorly this area which is present, this part anteriorly, this part is the crus. And you can see between the crus anteriorly and the colliculi posteriorly, this is where the cavity is present, the aqueduct. Now, if you remember, in relation to the midbrain, the nerves that were present were the third cranial nerve and the fourth cranial nerve. That fourth comes out below the inferior colliculi, and the third is present a little higher up. So at the lower level, we'll see the fourth cranial nerve. At the upper level, we'll see the third cranial nerve. So that's how we are going to look at these sections of the midbrain. So let's look at the first section of the midbrain, which is at the level of the inferior colliculus. And again, the midbrain, the section is very typical. The crus is broader, so that's why the anterior part is much broader like this. Goes out this way. And in between the crus, you have an area which is, there's a little pit in between. And just to show you that, I'm going to go back to a few slides higher up, which is this area here. So notice how, if you look up here, see, these are very close to each other. See, if you draw it, these are very close, and then it kind of widens out like that. And then you come to the front where it's wide and this way. So this area in between is known as the interpeduncular fossa. This one here is called the interpeduncular fossa. And in this interpeduncular fossa, a lot of blood vessels actually pierce this area here in the middle. They pierce this area, and that's called the posterior perforated substance. It's called the posterior perforated substance. And this crus cerebri, as you notice, it bounds, it's a boundary of this interpeduncular fossa on the lateral side. The oculomotor emerges medial to the crus, and I told you the fourth emerges lateral to the crus. Now, on the posterior aspect, these colliculi, they are connected to the thalamus by what are known as arms. So if I was to draw the colliculi, that's the superior colliculus and that's the inferior colliculus. This is the thalamus. So these are connected to the thalamus by little bridges of nervous tissue like this. These bridges are known as brachium for arm. The upper one is known as the superior brachium and the lower one is called the inferior brachium. The superior connects the superior colliculi to the thalamus, to an area on the thalamus which is known as the geniculate body. It's called the lateral geniculate body. And the inferior brachium connects the inferior colliculus to something known as the medial geniculate body. So, and these two are part of the thalamus. So that's what the brachium represents. So let's look now at the section of the midbrain. So we are looking at the section of the midbrain, and again we divide this posterior to that aqueduct. This area of the colliculus is known as the tectum. Then anterior to the aqueduct, this whole part together is known as the cerebral peduncle, and this is further divided into a part called the tegmentum, which is more posterior, and then a part called the crus cerebri, which is more anterior. So the cerebral peduncle is divided into the tegmentum and the crus by means of a pigmented layer which is present here. That pigmented layer has, the cells have melanin which is known as neuromelanin. So this area really stains black. That's why it's called Niagara for black. Substantia, remember substantia was another a name for cell bodies, so it's cell bodies which are little black because of the neuromelanin present here. So this substantia nigra is present here, and that divides it, this region, into a tegmentum posteriorly and a crus cerebri which is present anteriorly. Now here let us look at what are the nuclei which we are going to see. So let's go from the posterior part. In the colliculus, we actually have a nucleus present in that colliculus, which is the nucleus of the inferior colliculus. So this part here is called the nucleus of the inferior colliculus. Then we have the because the fourth nerve was the one coming out, so we have the nucleus of the trochlear nerve. So here we have the nucleus of the trochlear nerve. The other nuclei present here is this substantia nigra. Nuclei, remember, were collections of nerve cell bodies. So we have the substantia nigra. And then the fifth nerve, if you remember, again, the fifth nerve I told you went all the way, there were nuclei which went all the way from the midbrain down to the pons. Now from midbrain down to the medulla. In the medulla and the lower part of the pons, the nuclei was known as the spinal nucleus of the fifth. These are all sensory nuclei. In the upper part of the pons, it was called the sensory nucleus of the fifth. And then in the midbrain, this nucleus is known as the mesencephalic nucleus. So here we see the mesencephalic nucleus of the fifth. So this is that little nucleus present here, which is the mesencephalic nucleus of the fifth. So these are the main nuclei that I want you to remember. Everything that's marked with an X, I don't really want you to see. I don't pay attention to that. Then let us look at the tracts which are present. And for this, again, I want you to look here at this image because this is really good. Notice in the midbrain, so this is in the midbrain. If you notice in the midbrain, the descending tracts and the corticospinal and the corticonuclear, these are present in the center of this crus. So in the center of the crus, in this area is where these descending corticospinal and corticonuclear tracts are present. On either side of these, this in the crus, on either side are fibers which come from different parts of the cerebral hemisphere, which I mentioned in the Pons, and I call them the corticopontine fibers. So they kind of travel this way. So they travel medial and lateral to this corticospinal and corticonuclear. So these are the corticopontine which are coming down, and then they synapse on the pontine nuclei. So that is what is seen. So let's go back, and that is what is seen up here. So in this area, in the central part of the crus, this area here, you see corticospinal and corticonuclear fibers which are present. So the corticospinal will travel all the way down. The corticonuclear here will be fibers which will go to the 4th nerve here. If it was in the Pons, the fibers would have gone to the 6th and the 7th. And in the medulla, they would have gone to the 10th, 9th, and 11th. So that's what these corticonuclear do. Remember, they peel off at every level. And on either side, you can see these are fibers coming from different lobes of the cerebral hemisphere. So here you can see they are called frontopontine. And over here, these are actually temporopontine, paritopontine, and occipitopontine. So collectively, we can call these corticopontine fibers. So those are the ones which are traveling in this medial and lateral parts of the crus, and in the middle is the corticospinal and corticonuclear fibers. The sensory tracts present at this level, you will have the lateral lemniscus. So they all kind of lie very close to each other. So what you have is, in the middle you have the medial lemniscus. This medial lemniscus is joined by the trigeminal lemniscus. Then lateral to this we have the spinal lemniscus, and further lateral we have the lateral lemniscus. So these are all the lemnisci which are there. So you can see the medial lemniscus, the spinal lemniscus, and the lateral lemniscus. So they each have their own position present there. The trigeminal lemniscus actually joins, part of it joins the spinal and part of it joins the medial. So when we do the trigeminal system, I'll kind of go into a little more detail. So that's what you see at this point. And then this here is the cerebral aqueduct, and around it you can see a little bit of gray matter. These parts you can ignore. So this is what you're seeing at the level of the inferior colliculus. So you can see this is the trochlear nerve. And if you remember the trochlear nerve, I told you the nucleus of the trochlear nerve, this was one nerve which emerged dorsally. See, everything else, whenever we drew the nuclei, remember we always showed it emerging ventrally, because this is always the ventral aspect and this is the dorsal aspect. Here in the case of the trochlear nerve, notice how it comes out here, then it crosses over up here and then goes off, and that's how you see it on the lateral aspect of the crus. See, this is the crus, the lateral aspect of the crus is where you see this 4th nerve. So this is where the trochlear nerve nucleus is, and it is seen at the level of the inferior colliculus. Now let's go to the next level, which is the level of the superior colliculus. And again, at the level of the superior colliculus, you have certain common things. The shape remains the same, and certain things change a little bit. So let's see the nuclei which we see at this point. So now instead of the nucleus of the inferior colliculus, we have the nucleus of the superior colliculus. Instead of the 4th nerve nucleus, now we have the nucleus of the 3rd nerve, which is the oculomotor. See what I mean by it coming out on the ventral aspect? You can see as it's coming out here, it is medial to the crus. So this was the crus, this is medial to the crus, and so you can see it. The 4th came out this way, lateral to the crus. So we have the nucleus of the oculomotor nerve. With the oculomotor, this red one here is the Edinger-Westphal nucleus. This is the parasympathetic. So remember, the parasympathetic went with the 3rd, the 7th, the 9th, and the 10th. And we saw the 9th and the 10th, we saw the parasympathetic in the medulla. The 7th, if you remember, those lacrimatory and salivatory we saw in the pons. Now this is in the midbrain, and the nucleus which belongs to the parasympathetic part is called Edinger-Westphal. So from here, the preganglionic fibers begin. They will travel with the 3rd, they will go and synapse, and then the postganglionic fibers which begin from here, they go on to supply the smooth muscle which is present in the eyeball. So they go to supply the sphincter pupillae. So you can see these are preganglionic fibers which are beginning from the Edinger-Westphal nucleus. So those were the nuclei you see here. Well, in addition to that, the substantia nigra is there. I told you that earlier. The mesencephalic nucleus, we saw that. And then now we have the addition of a nucleus which I've been talking about fairly often, which is the red nucleus. So this is the red nucleus. It's got a pinkish tinge, that's why it's called red nucleus, because of a pigment present in it. And fibers from the red nucleus actually go down to the spinal cord, and those were the ones we called rubro for red, rubrospinal fibers. And then we'll see how fibers from the red nucleus go across and they go up to the cerebral cortex, and these are known, they go first to the thalamus, so these are called rubrothalamic fibers, and when we do the thalamus we'll see that. So this is the red nucleus, an important nucleus that we see at this point. So this is what is seen at the level of the superior colliculus. The sensory tracts we see, we'll still see the same, over here we'll see the medial lemniscus, the spinal lemniscus, the trigeminal lemniscus, but the lateral lemniscus is not seen at this level, because the lateral lemniscus is to do with the auditory pathway, and from the inferior colliculus it passes out. So now at the superior colliculus it's no longer present. So that's why you don't see the lateral lemniscus at this point. So important for you to remember that the lateral lemniscus begins in the pons, it ends at the level of the inferior colliculus. It's not seen at the level of the superior colliculus. So that's an important thing to remember. And the other fibers, they remain the same. You see the corticospinal and corticonuclear, and then you see the corticopontine fibers, just as in the case of the inferior colliculus. So this is what you see at the level of the midbrain. Now I want to tell you a little bit about the corticonuclear fibers, and for that, what I want, all this while we've been saying that from the cerebral cortex, so from here, the fibers which come from this motor area, mainly from the motor area, as they came down, most of them were destined for the spinal cord. So these descending tracts, they crossed over, and then we started calling them the lateral corticospinal. Now at the level of the midbrain, pons and medulla, so in other words at the level of the brainstem, some of these fibers peeled off and they went to the respective cranial nerve nuclei which had motor functions, and these were the 3rd, the 4th, the 5th. That means all the cranial nerves which supplied muscles in the head and neck area, the 3rd, the 4th, the 5th, the 6th, the 7th, the 9th to the 12th. So it goes to all these cranial nerve nuclei. So what happens is that the corticonuclear fibers, most of them, so let us say that in the midbrain these are the 3rd and 4th, here you have 5th, 6th and 7th, and 9th, 10th, 11th and 12th in the medulla. So I'm just drawing them like this. So this is from one side, and let's say this is the cerebral cortex of the other side, so fibers traveling down that way. So each of these cranial nerve nuclei, with the exception of the 7th, so let's forget the 7th for now, but all of the others, they actually receive, we all know that the one cortex, the cortex of the right side, influences the left half of the body, right? It has control over the left half. So you saw how the corticospinal fibers, they crossed over. So from the right, they went to the left. Well, this is actually the left cerebral hemisphere if you look at this image. But anyway, now the corticonuclear fibers, what happens is actually they have a bilateral control. So they not only receive fibers from the opposite cerebral cortex, they also receive fibers from the same side cerebral cortex. So if this is one corticonuclear, this is one cranial nerve nucleus, and I take any one other than the seventh. So this is the midline. It will receive corticonuclear fibers from the opposite side, but it will also receive corticonuclear fibers from the same side. The influence of the opposite side is much more. This is how it is. So that's the important thing to remember. The influence of the opposite side is much more, but the influence of the same side is still there, but not as much as this side. So all cranial nerve nuclei with the seventh has this, they have this function. The seventh is slightly different. And for this, you have to listen to this carefully and listen to it a couple of times. So let's see that if this is the face. So we're looking at the face up here. And this here is the brain. And the pons. So instead, it doesn't matter. Let's say this area here somewhere is the pons. And well, just to be anatomically correct. And let me just say that this is this area here at this point is the pons, and so I'm going to draw it this way. And so this is the seventh nerve nucleus present in the pons. And now this is the seventh nerve nucleus, which is going to give rise, these are like the anterior horn cells of the spinal cord, and fibers coming out from here are going to form part of the seventh nerve, the motor fibers of the seventh nerve. So this is the seventh nerve. This is going to be influenced by corticonuclear fibers. So corticonuclear fibers will come from the brain. They'll travel from these are the descending tracts. They'll come from the brain and they will synapse on this, and then these fibers will come out. So this is the lower motor neuron, the nucleus and the nerve, and this is the upper motor neuron. Now what happens is that this seventh nerve nucleus, I'm going to take it on this side, this seventh nerve nucleus, the cells in the seventh nerve nucleus are present in such a way that we can kind of almost arbitrarily divide it into two parts. So there are cells present in the upper part of the nucleus, there are cells present in the lower part of the nucleus. The cells for the upper part of the nucleus, they come and supply the upper part of the face. So if I divide the face like this, the cells for the upper part of the nucleus come and supply the muscles of the upper part of the face. So they travel with the seventh nerve, but these axons which originate from here come to supply the upper part of the face. The axons which originate from cells in this lower part, they come and supply muscles on the lower part of the face. So just so that you understand, so what will happen is, suppose I was to artificially destroy these cells up here, you will understand that then the upper part of the face on this side is not going to get any nerve supply, so this upper part of the face will be functionless, whereas the lower part of the face will be okay. Instead, if I destroy these and let those be, the lower half of the face will be paralyzed, but the upper half of the face will remain the same. So this is something you should understand. Now let's look at another concept. So again, here we are going to draw our face. And here is the pons. Here's my seventh nerve nucleus, and I divided it arbitrarily into two parts. So I'm just to use a different color. From the upper part of the nucleus, the fibers are supplying the upper half of the face. From the lower part of the nucleus, the fibers are supplying the lower half of the face, right? They all travel within the seventh nerve. So this is the seventh nerve. So this is the nucleus, and these are the nerve fibers. So this one we will call the lower motor neuron. Now this is influenced by fibers which are coming from the descending tracts. And I had earlier said that all cranial nerve nuclei have a bilateral supply. You know, they have a supply from the opposite side, but they also have a supply from the same side. In the case of the seventh nerve, it's slightly different. So you need to pay attention really, really carefully. So what happens is that we know that all cranial nerve nuclei have a connection with the corticonuclear fibers of the opposite side. So what happens, these are fibers which are coming from the cerebral cortex. So let's say this is the cerebral cortex here. So from the motor area, the cortico descending tracts come down and they cross over, and then they supply this way. They supply the entire nucleus, both the upper and lower part. So can you see that they are supplying the entire nucleus, both the upper and the lower part? But fibers from this side, we had said earlier that cranial nerve nucleus, so if we took any cranial nerve nucleus, let's say this was third, I had said that it has fibers which from the opposite side, but it had fibers from the same side. So all cranial nerve nuclei are kind of bilaterally controlled, with the opposite side being greater. And this entire nucleus also has a control from the same side. In the case of the seventh, it's not the entire nucleus. Instead, it's only a part of the nucleus which has control from the same side. So it's only this upper part of the nucleus which gets fibers from the same side. So in other words, it's only the upper part of the nucleus which is bilaterally controlled. The lower part of the nucleus is only unilaterally controlled. And if you look up here, so let me say I use another color, and I'll use blue. Just say, so from this side, fibers from here will cross over. They will influence this entire nucleus, but they'll only influence the top half of the nucleus. So can you see that this top half of the nucleus is getting fibers from this same side, but it's also getting fibers from the opposite side. The bottom half of the nucleus is getting fibers, is controlled by fibers only from this side. It is not controlled by fibers from this side. Okay, so what you need to understand, so just so that there is no confusion, so I'm going to draw the nuclei. So these are the nuclei which we divided into two parts. This will influence both sides, but it will only influence the same side top half. This will influence both sides here, but only influence the same side. So can you see that the lower is only is controlled by fibers only from the opposite side? Now let's see what happens whenever there is a nerve lesion. So let's say that there is a nerve lesion somewhere. And let me just say that there is a nerve lesion, these corticospinal fibers which are coming down, and this might give you this might erroneously give you the impression that they're kind of peeling off. So they really don't peel off. They just travel together like this way, and here they're traveling together this way. Okay. Now let us say that somebody has a stroke and the corticonuclear fibers are damaged, and the corticonuclear fibers which supply the 7th nerve nucleus, those are damaged, which is this. These fibers we will call upper motor neuron. So if this is damaged, if these corticonuclear fibers are damaged, so I'm saying that these are damaged, right? Notice what will happen. Everything in green will go. So the fibers to the same side, so there will be no impulses relayed to the upper half of, and let's say this was the left side and this is the right side. There'll be no impulses relayed from this one to the upper half on the left side. There will be no impulses relayed to the upper and the lower half on the right side. So this will go, this will go, and this will go, right? So just to show you, I'm going to say rub off everything that goes. I'm going to erase everything that goes. So this goes here. This goes here. This goes here. So now that should kind of give you a good idea. Right. So this is where the damage is. From here, from this upper part, the fibers will go to the upper half of the face. From this lower part, the fibers are going to go to the lower half of the face, right? So that means this, which is here. So we had destroyed this. So we can see that the upper part of the nucleus, the fibers from that have gone, and from the opposite side, both the upper and lower, the impulses from this corticonuclear has gone. Now let's see what is happening. So the fibers begin from here. Now let's look, we have damaged this. Now it lost, the impulses didn't go to the upper half of the nucleus on the same side. So the nerves, the 7th nerve which comes out from here, from this upper half, it's still getting impulses from this blue fiber which is coming from this side. So this one is safe. This is anyway getting impulses from this side. So this is safe. So this entire 7th nerve on the side of the lesion is safe. Let us look at the contralateral side. This was getting impulses from this side, so it does not have any green fibers, but it still has the blue fibers from the same side. So the axons are still getting impulses from the same side as the nucleus is. So the upper half of the nucleus on this side is safe. But the lower half of the nucleus, you can see there is no impulse coming to it. There are no blue fibers, there are no green fibers. So you can see that the lower half of the nucleus on the contralateral side, remember we said contralateral as related to the lesion. So the lesion is on the left, the contralateral side, which means the right side nucleus, the lower half of the nucleus now is not getting any impulses. So, and any impulses, why it's not getting any impulses? Because it gets upper motor neuron fibers only from the opposite side. So we will see that the lower half of the face, which is this part of the face, on this left, the lesion is on the left, the lower half on the right side. There are no impulses coming to the muscles of the lower half of the face. They are not being controlled because these are gone. So there is what is called an upper motor neuron type of lesion on the lower half of the face on the contralateral side. The lesion is on this side, the effect is on the contralateral side. So again, to repeat, first thing, the neurological deficit is on the contralateral side because the lesion is on the left, the neurological deficit is on the right. Where is it? On the lower half of the face, on the lower half of the face. What kind of lesion? An upper motor neuron type. Why upper motor neuron? Because the upper motor neuron has been damaged. This is the upper motor neuron has been damaged. In order for this lower motor neuron to work, it has to have impulses come from the upper motor neuron cells to tell it what to do. So if that is itself gone, the lower motor, you have an upper motor neuron type of lesion. The upper half of the face is okay because remember it got a dual supply, because it got not only from the same side, it got from the contralateral. So if the contralateral is gone, the same side remains. So the upper half of the nucleus, which supplies the upper half of the face, is always safe in an upper motor neuron type of lesion because it's got a dual supply. So if one goes, the other one still gets impulses. So in such a case, what happens is that when you tell such a person to smile or do something, they will be able to do it on this side, but they cannot do it on the lower half of the face. They are not able to smile on this side because this side, there is nothing coming. They can close their eyes here because this is supplied by the upper part of the nucleus and those axons coming from there are fine. But here it's the lower half of the face which is damaged. So that is what happens in upper motor neuron type of lesion. In lower motor neuron type of lesion, unless the nucleus is theoretically just only the upper part of the nucleus is damaged or the lower part of the nucleus is damaged, usually it's the entire nucleus which is gone or it's the nerve which is gone. So in lower motor neuron type of lesion, suppose it occurred at the nuclear level, that means the entire nucleus was damaged. These fibers came down and they supplied upper and lower half of the face. So the lesion is on the left, the deficit is also seen on the left. So lower motor neuron type of lesions of the facial nerve nucleus, or the nerve which emerges immediately after the nucleus at this point, is seen on the entire half of the face, and it is seen on the ipsilateral side. That means the same side as the lesion. So this is very important for you to understand. And let's see what this next picture is showing. It's really showing you the same thing. So here I'm trying to show you, this is the nucleus present at the level of the pons, the facial nerve nucleus present at the level of the pons. The upper part of the nucleus supplies the upper part of the face. The axons from here supply the muscles of the upper part of the face. The axons from the lower half of the nucleus supply the lower part of the face. So both the nucleus and the nerve are known as lower motor neuron. Here you can see these corticonuclear fibers. From the opposite side, they control the entire nucleus, but from the same side, only the upper part of the nucleus gets a dual supply. So that's why that upper part of the nucleus is little safe, and the fibers which travel from there are safer. Because if you damage this one is not getting anything from here, but it's still getting impulses from this side, so it can still function. So here you can see that in the what is called upper motor neuron type of lesion, which is known as supranuclear because it's above the nucleus. So here what is shown is that this side is damaged either right at the cortex or as the fibers are coming down. So this side will remain fine because this gives fibers here, but this side, since the nucleus on the top gets a dual supply, the axons remain safe. So this right half of the face is entirely okay. The left half of the face, the upper part is okay, but it's only the lower part which suffers. So you get, when you ask, you will find that the person's the lips, the buccinator muscle is damaged, so it cannot keep the cheek close to the mouth. So there is drooling from the side of the angle of the mouth on this side. So you can see that the contralateral lower half of the face is affected in upper motor neuron type of lesion. If it was a nuclear lesion or an infranuclear, nuclear means this entire nucleus has gone, or these nerve fibers as they are exiting, let's say from the internal acoustic meatus. At that point, if that whole thing is gone, since now neither the upper half of the face or the lower half of the face is going to get any supply, you will notice this person cannot close their eyes properly. Notice how if you ask this person to wrinkle up their forehead or look up or close their eyes shut or smile, they can do everything on this side, on the left side. But on the right side, their eyes cannot be closed because the orbicularis oculi muscle is paralyzed. So there you'll see tears coming out all the time. They cannot wrinkle their forehead because the frontalis has gone. So the forehead is smooth on that side. there is drooling of the mouth at this point because the buccinator and the anguli oris, all of these muscles have gone. So the entire half of the face is paralyzed on the side of the lesion. The lesion is on this side, on the right, the entire right side is paralyzed, and such a type is a lower motor neuron type of paralysis. So this, listen to this a number of times and try and work it out yourself. Now this next image shows you that, and you can see here this is facial paralysis of the lower motor neuron type, and I've covered this half of the face, and this patient has been asked to look up, wrinkle their forehead, and you may not be able to see, but the forehead is slightly wrinkled up here. The eyebrows have moved up. They are looking up, so they're using their levator palpebris superioris and so on. And if you ask them to shut their eyes, they would be able to shut it. You ask them to bare their teeth, and when you bare your teeth, even your platysma kind of comes into action. So you can see that they can bare their teeth, and notice how the platysma is standing out. And you're able to bare their teeth. If you ask them to sort of blow from this side of the mouth, they'll be able to do that using the buccinator. Now, when we ask them to do, we obviously will ask them to do this, together. But I'm showing you what is seen on the left side, which is absolutely normal. On the right side, and if we were to move this, notice they were doing that. You see over here, there are no furrows here. The eyebrow remains, at the same level. Notice how this part, there's a pouch formed, and you can't see it, but then, tears would flow out. They cannot bare their teeth. This angle is drooping. So you can see that there is a lower motor neuron paralysis on this side. So the entire nucleus or the nerve on this side would have been damaged. So that is what is seen in facial paralysis. So very important again for you to understand how the corticonuclear fibers are different in the case of the 7th cranial nerve, and you should be able to work this out. So I'm going to stop here so that now you understand the entire brainstem, and then my next presentation will continue with this very same PowerPoint where I'll do the trigeminal system and the auditory pathway.